Today we will discuss IBS, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Irritable bowel syndrome, IBS, is a common digestive disorder that affects the large intestine. In simple terms, it means your gut is sensitive and can cause symptoms like abdominal pain or cramping, bloating, gas, diarrhea or constipation, or alternating between both. To know if you might have IBS, consider these steps. 1. Symptoms. Are you experiencing any of the symptoms mentioned above regularly? 2. Duration. Symptoms should occur for at least 3 months. 3. Triggers. Do certain foods, stress, or lifestyle changes make your symptoms worse? 4. Diagnosis. A doctor can help diagnose IBS by ruling out other conditions. They may ask about your medical history, perform tests, or suggest a food diary. If you suspect you have IBS, it's best to consult a healthcare professional for an accurate diagnosis and advice. If someone has IBS, here are some simple steps to manage it. 1. Diet changes. Eat smaller, more frequent meals. Avoid trigger foods like spicy, fatty, or dairy foods. Try a low FODMAP diet, which means cutting out certain carbs that can cause gas and bloating. 2. Stay hydrated. Drink plenty of water, especially if you have diarrhea. 3. Exercise. Regular physical activity can help relieve symptoms and reduce stress. 4. Manage stress. Try relaxation techniques like deep breathing, yoga, or meditation. Keep a diary. Track what you eat and your symptoms to identify patterns and triggers. 6. Medications. Consult a doctor about over-the-counter options or prescriptions if needed. Regular checkups. Stay in touch with a healthcare provider to monitor your condition and adjust your plan as needed. These steps can help manage IBS symptoms effectively. In the hospital, if someone with IBS has severe symptoms or complications, doctors may do the following. 1. Assessment. They will check vital signs and ask about symptoms to understand the situation. 2. 4. Fluids. If the person is dehydrated, especially from diarrhea, they may receive fluids through an IV. 3. Medications. Doctors might give medications to relieve pain, reduce diarrhea, or help with constipation. 4. Dietary changes. They may provide special foods or liquids that are easy to digest. 5. Monitoring. The medical team will keep an eye on the person's condition to ensure they improve. 6. Further tests. If needed, they might run tests to rule out other conditions. These steps help manage severe IBS symptoms and ensure the person's safety and comfort. Here are some common types of medications used to treat IBS. 1. Antispasmodics help relieve abdominal pain and cramping. Examples: dicyclomine bentyl, hyoscyamine, Levsin. 2. Laxatives used for IBS with constipation. Examples: polyethylene glycol, lactulose. 3. Antidiarrheal medications help control diarrhea. Examples: loperamide, Imodium. 4. Probiotics can help balance gut bacteria and improve symptoms. Examples: Lactobacillus, Bifidobacterium. 5. Medications for specific symptoms. Rifaximin, an antibiotic used for bloating and diarrhea. Aloxadoline, Viberzi, helps control diarrhea in IBSD, diarrhea predominant. 6. Antidepressants. Low doses can help with pain and improve gut function. Examples: amitriptyline, duloxetine, Cymbalta. Always consult a healthcare provider for personalized advice and to determine the best treatment. People at an increased risk of developing IBS include 1. Women. Women are more likely than men to have IBS, especially younger women. 2. Age. It often starts in young adulthood, but can occur at any age. Family history. If someone in your family has IBS, you may be more likely to develop it too. 4. Stress. People who experience a lot of stress or anxiety may have a higher risk. 5. Diet. Those with a diet high in fatty foods or low in fiber may be more prone to IBS. 6. History of gastrointestinal issues. People who have had food poisoning or other gut infections may be at risk. These factors can increase the likelihood of developing IBS, but it can affect anyone. Now you need to watch my video on bronchitis, or have a look at pneumonia.